Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series 51. RNA is nothing but random questions in neurology and neurosurgery with answers by me, Dr. Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. The question that I'm addressing in this RNA series is, what is CADASIL? Or what are the features of it? CADASIL is an acronym for Cerebral Autosomal Dominant Arteriopathy with subcortical infarcts and leukoencephalopathy. It is a hereditary small vessel disease of the brain caused by mutations in the Notch3 gene. CADASIL, Cerebral Autosomal Dominant Arteriopathy with subcortical infarcts and leukoencephalopathy. The inheritance is usually autosomal dominant, Notch3 gene mutation seen in chromosome 19. The abnormal Notch3 receptor protein accumulation occurs. Degeneration of the vascular smooth muscle cells. The electron microscopy hallmark is the granular osmophilic material deposition in the vessel wall. And this mutation leads to small artery wall thickening and fibrosis, which leads to reduced cerebral perfusion, which leads to recurrent lacunar infarcts, and that leads to progressive white matter degeneration. This primarily affects the subcortical white matter, the basal ganglia, and the thalamus. The clinical features of CADASIL include the migraine, often with aura, the common first symptom, age between 20 to 40, recurrent strokes, lacunar strokes without vascular risk factors, stepwise neurological decline. The third feature is a cognitive decline, executive dysfunction, subcortical dementia pattern, psychiatric symptoms. They can develop like depression, apathy, mood changes. Late stages, they have the severe dementia, gait disturbance, and cerebral palsy. The MRI findings are highly characteristic. Symmetrical white matter hyperintensities, anterior temporal lobe involvement, which is very, very suggestive of this disease, external capsule hyperintensity, lacunar infarcts, microbleeds. In a young patient with a stroke plus anterior temporal lobe lesion, think of CADASIL. Now, the diagnosis is a clinical suspicion in MRI pattern and the genetic testing for the Notch3 mutation, which is confirmatory. The differential diagnosis, multiple sclerosis, sporadic small vessel ischemic disease, mitochondrial disorders, and a CADASIL of a rare recessive variant. Treatment, no disease-modifying therapy yet. The management is supportive. Antiplatelets, carefully bleeding risky microbleeds, migraine control of the vascular risk factors, cognitive rehabilitation, genetic counseling, very, very important. Avoid thrombolysis in unclear cases. Excessive anticoagulation, if microbleeds are present, you have to be very, very careful. The prognosis is a gradual cognitive decline. Many patients ultimately might come to wheelchair-bound stage, and the life expectancy is reduced but variable. And there are lovely articles on this by Chabria et al., Jode et al., Dichigens et al., and these are all published in Stroke Journal 2017, Nature 1996, and Lancet Neurology 2009. That's indeed the features of CADASIL. Thank you very much.